OBGYN landmark papers. This one is de Gaulle et al. Hopefully I'm saying it correctly. And this paper is titled Antibiotic Prophylaxis for Prevention of Postpartum Perineal Wound Complications. Paper was conducted at Santa Clara Valley Medical Center in conjunction with Stanford, published 2008 in the Green Journal. What they were looking at was whether or not administering antibiotics at time of oasis repair could reduce perineal breakdown 2 weeks postpartum. The patient population was 3rd and 4th degree lacerations, and they were divided into 2 arms, intervention and placebo. Intervention arm got cefoxitin or cefotetan at 1 gram at time of repair. So for their numbers, there's 147 patients conducted into the study, 64 were in antibiotic and 84 were in placebo. There was a 27% loss to follow-up rate by the 2-week follow-up, but at 2 weeks follow-up and looking at both the arms, in the antibiotic arm, 8.2% had a perineal complication, while in the placebo arm, it was 24%, which was a p-value of 0.037. There was no difference in diabetes, type of operative delivery, or percentage of 3rd and 4th degree lacerations between the 2 groups. The 2 important things to note from this paper were that, yes, this was in 2008, but this is one of the few prospective studies that actually looked at this. That being said, though, the practice bulletin from ACOG recommends it as level B evidence, giving cefoxitin or cefotetan at time of oasis repair. The other thing to note about the paper, though, is that this was a high prevalence of 3rd and 4th degree lacerations, around 11%, and at least in the institutions that I'm at, they're not as common as that. So to do repeat studies like this, you would need a higher number of patients in order to accrue actually that high number in order to assess. And the other thing, obviously, for this is that they looked at a 2-week breakdown. So there is a possibility that could be in the future that you could look at a 4-week or a 6-week postpartum visit and assess to see if there's any perineal wound complications at that time. The issue with that, though, is that there was a 27% loss to follow-up already at 2 weeks, so the expectation would be that there would be percentage higher at increased loss to follow-up at further postpartum visit dates. That's a simple breakdown of antibiotics for oasis. Hope that helps. The more you know.